although nobody probably will till 11. Oh, there's Tom.
And good morning, everyone. We're just waiting for others to join. I think my audio is on. Yes.
Two more minutes and we'll get started. We do have a pretty good number of people that have joined though, so that's good.
And I'm just trying to get my screens arranged so I can see things in the chat box or the Q&A. Trying to find the chat box yet.
All right, well, I have 10 o'clock, so we're gonna go ahead and get started. Welcome everyone. We actually have a few more attendees than we had anticipated, so that's great. This will be recorded and we are going to distribute it to the PAAW membership at the conclusion, well, after it cooks, as Amanda likes to say. It takes a couple of hours for that to happen. So I'm Chris Anderson, PAAW president. I just want to welcome everyone today. I just want to introduce our speaker, I guess, our panelist today. We're talking about Wisconsin CARES Act provider payments, and I know that for those of you who are following the news as far as the governor's appropriation of this funding, it is very disappointing that they're offering us a $1,240 initial payment, no matter how big or small your service is. It's actually insulting if you ask me, but that's my personal opinion. We are going to continue to fight. We're going to do another press conference. Once the information is released on the second round is what we're going to talk about today and how to apply for it. Once we have a better idea of what that second round entails, if we're not satisfied with it, we're going to go public and we're going to voice our concerns. And it's kind of the time to take the gloves off, if you will. But we'll certainly be in touch with our board members and our membership at large when the time comes. So Wayne Jarecki works directly with me, closely with me at Bell Ambulance. He's also a AAA board member and much more of a financial expert than I am. So he has agreed to host this for us today. So thank you, Wayne, and go ahead and take it away.
Good morning. Thank you, Chris. Here this morning, wanting to talk about the Wisconsin DHS CARES Act provider payment and the application process. The governor has allocated $100 million into this fund for certain provider types, namely long-term care. So here we have home, community-based service providers, assisted living, nursing homes, and then finally emergency medical services. So today I will only be talking about the emergency medical services aspect of this and the information required to complete your application. They have not redefined emergency medical services agencies in this application, so we are to assume, or we only assume, that it is anybody with any EMS license in the state of Wisconsin, regardless of transporting entity or not. So first responders would appear to be eligible. Again, I guess Chris didn't say this in the introductions. I should. I'm not an attorney. I'm not an accountant. This is not legal advice. This is not accounting advice. This is just help as a provider peer working through this application process. We at PAAW have had many discussions over what some of these items mean and what supporting documentation you will need. So this is just a best effort at this point. I'm going to jump into here. I first started off trying to make slides to be able to discuss what data you needed, and it appeared I was pretty much duplicating the website that the application is actually on. So I figured it would work better for us to walk through the actual website, talk about what data is being requested, and how you actually submit this application for your agency. The initial website link is on this slide here. It brings you to the department's page that gives you information about this and a few other things. But on the top of the page, the left half of the slide here, you'll see there's an Apply Here link, which brings you to the right half screen. You do need a unique login to be able to get into this provider payment application. It is not a common login for anything else you have with the state. You just register. It's a very simple registration, name, email address, verify your email, and then you're off to the races where you can go in and start an application. Once you log in, you get presented with a screen that shows you the applications that you've already started on the bottom. Here in this case, I have not started any, and gives you a little bit of an overview of what you're going to be doing. So we'll start a new application. They present you with the introduction, which tells you that you're going to need your 2019 tax returns or draft 2019 tax returns. In their FAQs, they've clarified that if you have not completed your 2019 taxes, you actually submit your 2018 taxes and a 2019 profit and loss statement. We'll talk about this more as we get to the actual data you need to extract from these statements. Makes it clear that you can only submit one application per tax identification number per provider type, and that these applications are for your operations in Wisconsin only. So if you are multi-state, they're wanting data that is specific to Wisconsin. The first part of the application is very simple. It's your contact information, who you are, how they can contact you. We then go into more meaningful things, information on your agency, your tax ID number. These are required data elements. Other things that they ask for are your Medicare provider number. If you are a vendor for the state, you can apply, add your STAR number. Provider type, your NPI, your Medicaid ID number, and your state of Wisconsin EMS license number. All of these things should be very readily available to you. If you don't have them, your billing agency will certainly have your NPI and the Medicare and Medicaid numbers for you. What counties you operate in, they do not make it clear as to if this is only primary service area or all service area. I don't see anything that indicates that the counties will actually drive the amount of funding. Now, some of the data that you need to put together that may not be immediately available, but should be easily accessible from your payroll department or your payroll processing service, is the gross monthly payroll broken down for January through May. These numbers are the gross payroll, all in. This is not net of any taxes. This does not define adding anything to it. It's straight up gross payroll. These numbers, again, should be readily available from your payroll processing or payroll department. We then move on to mailing address and physical address. The mailing address, there is a caution here that you want to be sure to use the same address that you have on file with Forward Health, assuming you are a Medicaid provider, as the checks address. They're doing some verification of this address to make sure that this is being sent to the proper place. There's some FAQ supporting document on here that it may take them a little longer to get it to you if you pick an address that is different than you have on file with Forward Health. They do a little verification of your address and you can move on. Now we get to the real data. They need your organization's gross revenue for 2019. Like I said earlier, this would be on your 2019 tax forms, which would be your 1120 if you're a corporation, your 990 if you're a nonprofit. But they only want numbers for Wisconsin. This gets tricky for multi-state providers. There are other fields coming up that would be easier to break down by state. But for us at Bell Ambulance, being a single state provider, doing this is going to be, it's simply the numbers off of our tax return. As I go through here, all the numbers that I am putting in are just totally made up. They're fictitious for an arbitrary ambulance company that I only created in my mind. Now they ask about any other funding that you have received. This will be if you've received a PPP loan through the CARES Act, federal sick leave from the Families First coronavirus bill, where the federal government is reimbursing you for the enhanced family and medical sick leave. There is the HHS General Fund, both the Tranche 1 funding, that's the one that just magically appeared in your checking account based on your prior Medicare claims, as well as any HHS Tranche 2 funding. That's the process where you had to go online and provide prior year tax returns and fill out a DocuSign application. That all had to be done prior to June 3rd, I believe, is when the Tranche 2 funds were closed. In my fictitious company here, they only got the initial funds. They did not get any from Tranche 2, as well as any extended family medical leave reimbursement that you've received. So both the federal sick leave and the EFMLA relate to the Families First Coronavirus Act, and these would be funds that you have offset from your employer Social Security taxes. So your payroll company has taken care of getting this money from the federal government for you. The CARES Act HHS Tranche 1 funding that I have listed here, again, that was the automatic payment you received. And then any PPP loan that your organization has had approved for the organization. Again, this is limited to the tax ID number that we entered on the initial screen for the enterprise that we're talking about here. If you did not receive any of these funds, you could simply have answered no to this response, and then this section of the screen actually goes away. Do you have any other organizations that are on the same tax return? Are there other subsidiaries that received additional funds? You answer these as appropriate, and it turns on and turns off repeating sections of the screen we just saw where they capture the idea of what PPP or CARES Act funding have you received. Now we get into a discussion of the revenue that you have lost, and this is confined only to March through May. Right now, we're in the month of June, so you have to look at only data coming through May 31st. One of your concerns may be that you don't have your May 31st financials completed yet. They address this in one of their FAQs, and they say that you have until June 30th to submit this information, with the expectation that you should be able to get completed May 31st numbers by that time. They ask for what lost revenue have you experienced in March through May of 2020, and this is revenue that is related to the COVID-19 pandemic. They describe a methodology of calculating this revenue by comparing 2020 revenue to 2019 revenue. This is a little problematic for the EMS agencies because 2019, we obviously know for certain what our revenue is. We're a year past these months. So even with some payers taking 3 or 6 months to pay or finalize these invoices, we know with certainty what 2019 revenues are. 2020 revenue is going to have to take into account your expected revenue. What can you reasonably expect to collect in March, April, and May of 2019? They want you to report a single number for the difference of what your revenue was in 2019 to what your revenue is in 2020. So in this case, my fictitious company is going to receive, we're estimating, $287,312 less into these 3 months of 2020 than we did in 2019. They also are asking for additional expenses you've had to outlay for dealing with the COVID-19 pandemic. They have 4 defined categories of expenses. Some of them are very obvious. PPE, as we all know, has been a very large expense during this pandemic. They're looking for a dollar amount on the PPE that you bought in addition to your normal PPE. So if you routinely buy 1,095 masks per quarter, and now at this time you had to buy 5,095 masks, you would be able to report on here the increased N95 masks you had to buy. This does take into account today's pricing. So what was your actual expenditure? We all know that my example of N95 masks have greatly increased from what they were last fall. They also have a specific category for cleaning supplies. What other cleaning items have you had to get? Be it disinfectants, hand sanitizers, additional disinfectant supplies for the ambulances. What other cleaning equipment have you had to do to be able to appropriately decontaminate your vehicles, your facilities? Have you had a positive employee and you've had to go through and clean a station? All these are able to be captured and reported as additional expenses. Again, these are things that were incurred March through May. They do indicate in their FAQs that if your expense was incurred in the month of May, but the check was actually not issued until the month of June, that still can be reported on here. So these are hard expenses that were incurred during March through the end of May of this year. Facility modifications. If you went through and you added plexiglass dividers in between dispatch workstations or between your staff and public that may come to engage with your organization, be that for paying a bill or other interactions, these modifications can be reported as well. There is an other category for items that are not otherwise categorized that were expenditures that are directly related to the COVID-19 pandemic. In my fictitious company, we had a cleaning service come in to sanitize a station after an employee was found to be positive working out of that station. This service coming in and doing a deep clean was clearly something we would not have done if it were not for the COVID-19 pandemic. So we are able to include that in our expenses. They then ask about what staffing expenses have you had in March through May. Again, they have 4 specific categories that they ask for. And then there is an other catch-all. So in this case, my fictitious company had paid our staff in total $1,578 in hazard pay. If this were a shift differential or working on a specifically dedicated COVID car or something, it's a hazard pay that we paid our employees to make sure we had appropriate staffing. Here again, a fictitious company had a retainer payment. We gave bonuses to employees so that they wouldn't leave our employ and go work somewhere else. Although one would expect during a job downturn as we have that people may be migrating to EMS, but you never know. If you had to retain people through retainer payments, that is a specific category they've asked for. Overtime payments. This one was a little unclear, but you have to think about it. EMS agencies, we often pay overtime to our people. They frequently will work a 48-hour work week or 24-hour shifts. This is not all your overtime, but just your overtime that was caused by the COVID-19 pandemic. You may have had part-time employees that were students or something that left town, and now you're having to rely on your full-time staff picking up additional hours to complete your schedule so that you can continue your operations. If this is additional overtime that you would not have done if it were not for COVID-19, it's reportable. If you have sick pay that you paid out to your employees, that was not part of the family's first sick pay, we have to be mindful of double dipping. You can only report things once. So if you reported some sick pay for employees in, for example, the month of March before the family's first sick pay was enacted, you paid some people, you've got flu-like symptoms, stay home, we'd rather pay you to stay home, don't bring that into the workplace and infect your coworkers. We paid you some sick pay to stay home. Well, that can be reported on here as well. There's also an other category. Here, this fictitious company not only had retainer bonuses to keep some people here, but we were doing recruitment bonuses to make sure we could get enough staff to fill our staffing needs during this pandemic. This, again, is something we would not normally have done had it not been for COVID-19, so we can report it on here. You obviously need supporting documentation for all of these numbers, so be sure to have these in your accounting software or Excel sheets or some documentation for all of this when you submit it, because you can be subject to audit. We'll see that later in the application where they make it clear. So that's really all the numbers that we're putting in here. They're pretty easy to get. Most of them are payroll. Some are accounting where you needed to keep track of, hey, we bought extra N95s, we bought more gowns than we normally would. Then there are some routine documents that we have to attach to this application. One of them that they make very clear is required is an IRS Form W-9. This is where you provide your tax ID number to the state of Wisconsin using the IRS Form W-9, and it is signed by an authorized representative of the organization. That must be applied here. Then your tax return information. As we said earlier, if you have filed your 2019 federal tax return, they are asking for a copy of it. If your 2019 taxes have not been filed yet, they want a copy of your 2018 tax return, as well as your company prepared or accounting firm prepared profit and loss statement for 2019. Again, depending upon if your audit or review has been completed, whether you would use a company prepared or an outside CPA organization prepared financial statement. They do have in their FAQs that if you use a company prepared and then there are any substantial changes or actual changes to any of the numbers that you relied upon, you do need to inform the department of these changes once they are finalized. You also need to provide a copy of your IRS 941 for first quarter. This is something that your payroll department or payroll processing agency should be able to provide to you. Us being EMS agencies, we all have employees, so we should have a 941. There may be some scenarios where it's not covered through 941, but as far as I know, everybody should be able to provide that. And then all of our certifications, that we are using accurate numbers, that these are the actual tax returns and financial statements, that we certify that we are not double dipping, we're not reporting lost revenue to the state of Wisconsin here, that we may have also reported to another government entity or have been reimbursed by some other means. And then simply submitting our application. It is just that simple to do this. There are numbers that you have to calculate and put together. You ask very well, how much are we going to get? They outline how they're going to determine the first payment. This is by taking all of our lost revenue and expenses that we've entered on this application. In the case of my fictitious company here, we have $327,218 in lost revenue and additional expenses for equipment and facility modifications. From that, they're going to subtract any amounts received from the CARES Act Provider Relief Fund. My fictitious company here only received the tranche 1 funding from HHS, the one that automatically showed up in our checking account, of $58,672, as well as deduct any other government loans, think PPP loan, business continuation payments that were used to offset covered COVID revenue losses or expenses. So if you got any funding from FEMA, that should be in here as well and reported back on the original page. My fictitious company had some a PPP loan, had some Families First sick leave and Families First extended family medical leave for $251,399. When we do this math, we have a net COVID loss and additional expense of $17,147. And the state is saying that the initial payment for EMS providers is capped at $1,240. And that is without regard to the size of the EMS agency. Personal opinion here, seems a little crazy that an organization that may do 100,000 transports is going to get the same initial payment as an organization that does 100 transports. So it's the way they wrote it. It's what we would expect in the first round. It sounds via their FAQs that this first round payment is going to come out rather quickly. And then they are going to move on to round two, which they explain as they're going to wait until everybody's submitted. They're going to review everybody's application, calculate everybody's net losses. And this is not only EMS providers, but all the long-term care providers as well. Put them in a pool and proportionately pay out any additional funds available from the $100 million that's set aside for EMS as well as long-term care. What this is going to look like to each individual provider, this we don't know until all the numbers are in. And I think Chris has brought himself up here and may have something to add to this.
Well, this is the part that we're concerned about, and I just think that we're all going to be disappointed. I don't mean to be pessimistic, but it seems as though once again we're kind of pushed to the bottom of the list, and you know, it's partially our fault because we continue to do whatever is asked of us as an industry, and you know, that we're going to have to push back a little bit, and we're going to have to really be in touch with our legislators. And of course, they're not going to be in session the rest of this year. But you know, we're going to get organized and we're going to push our message harder than ever before. That's our only option.
So from here, I go on with a little bit of details on these. I know I've touched on it before, but we have to remember that 2019 filed tax returns otherwise use 2018 and a P&L. In some areas of the application, they refer to this as a draft 2019 tax return. And then later in the FAQs, they clarify that a P&L and a 2018 tax return are acceptable. Again, we have to be certain to not double dip. If you're claiming this lost revenue from some other reimbursement or FEMA has reimbursed you for the PPE, you cannot claim that PPE as an expense on this application. You can only claim help once, no double dipping. The deadline to fill this out is Tuesday, June 30th. So you have a little over a week and a weekend to work on this. And then there is one thing that on the application, you'll see that there's a big red cancel button on the top of the page. I got bit by this. I hit cancel thinking that I wanted to cancel my changes. Well, that's actually cancel your application. And if you do cancel the application, you cannot edit it and you have to start over. So be cautious of that cancel button. I got burned with it, had to get a hold of their help department. That took about 3 days to get me back in to be able to do the application again. So at this point, that's the end of everything that I had prepared. There is the question and answer tab. So if you have any questions, please type them into the Q&A tab at this point. And we would give you an opportunity to do that. I don't see any open questions at this moment. Chris, do you have anything else you'd like to add to this? We knew this was going to be a relatively straightforward presentation. We wanted to get something out there so that you understood what all was being asked for and provide an opportunity to get your peers to be able to help you understand what some of these data elements are. And I don't see any questions coming in. Chris, do you have anything you want to do for a wrap, Mr. President?
I just want to remind everyone, you know, it may seem a bit overwhelming, but it's really not. Anyone that's listening, I'm confident we'll be able to get through this. And as Wayne mentioned, if you have a billing agency, utilize them. If you have a payroll service, which I think most of us do these days, utilize them. And if you have questions, please reach out to us. And we, if it's not Wayne, one of the other board members will be able to help you. So, and remember, it is timely. You've got 11 days to get it done. And even if we end up getting less than we want, it's very important that we all submit our data just to show what kind of losses we're looking at throughout the state. We have to make sure we understand. It's kind of like the Medicare data collection program that's coming up. We want to show the reality of what we live in. Have they issued any recommendations for local government or EMS or fire agencies that don't file tax returns? That is our question. And I know I think there's an answer.
For the Wisconsin one, I don't see that they specifically answered that. HHS, when they were talking about Tranche 2 funding, that closed back on June 3rd, by the way. Their recommendation for local governments was to use governmental financial statements to be able to provide documentation. I have not seen a FAQ from the state of Wisconsin answering this direct question.
But
now, there is one thing that I didn't mention in here. If you go through and you calculate that you're not going to get any money from this because, say, for example, you got a large PPP loan or you got a lot of HHS funding, it's still important to put a submission in because we don't know if there's going to be another round of funding after this.
Right.
And so often we've seen in government grants and funding, you don't get round 3 funding if you didn't apply for round 2 funding. So that's our advice, is to apply for this. Even if you don't think you're going to get anything out of it, get yourself in line so that if there's more coming, they can't just say you're not eligible because you didn't do the previous step.
Right, exactly. And we want the data out there. We want the people at the state and DHS to see it, and we want them to see, you know, that a lot of us are having a hard time with this pandemic, making it through, and we want people to see that. So also feel free to email the whoever it was that Wayne contacted to get help with the website. I'm sure they can probably get you an answer as well on the local government not having a tax return question, if you want.
On the initial website that I gave, the CARES Act provider payment, where I showed that there was the apply here application, at the bottom of that same section is an email link to ask them questions. I found that they were able to get back to me in a day or 2.
Perfect. That's pretty good for state government. I don't see any other questions, so I think we are safe to wrap it up. Thank you very much, Wayne. We appreciate you helping us out with this. And thank you to our friends at the AAA for hosting us. And we will get the link out to all of our PAAW members. And so you can share this and watch it if you were not able to join us live. So thanks again, everybody.
Thank you all. Have a good day.